Hello to all cat lovers. In this video, we'll take a close look at the important warning signs of illness in cats that can easily be overlooked in daily life. We'll also discuss the most common feline diseases and their symptoms so that you can stay alert to your pet's health. Let's start with appetite. If your cat skips one meal, there's no need to panic. Maybe she's just in a bad mood or got scared by loud guests. That happens. But if your cat refuses food for more than 24 hours, that's already a red flag. Loss of appetite can point to many problems: gastritis, pancreatitis, dental or gum disease. Even a simple cold can cause this. When a cat loses her sense of smell, food becomes unappealing. Also, pay attention to water intake. If your cat starts drinking excessively, it may indicate kidney disease, hormonal disorders, or diabetes. On the other hand, if she hardly drinks at all, that's also cause for concern. Monitoring litter box habits is equally important. If your cat urinates more than 6 times a day, it could be a symptom of cystitis, urinary stones, or kidney issues. If the cat can't urinate, circles the litter box, digs, or meows plaintively, do not wait. Urinary retention is a life-threatening condition that requires immediate veterinary attention. The same goes for defecation. When cleaning the litter box, check the stool. It should be well-formed, without blood or mucus. If your cat hasn't had a bowel movement for 3 days, it may be constipation, especially if accompanied by vomiting, fever, or weakness. In that case, contact a vet right away. If your cat used to sleep sprawled out like a starfish or rolled onto her side, but now always lies curled up like a loaf and doesn't move, this may signal discomfort. Such tense, motionless poses often indicate pain, especially in the abdomen. In this position, the cat might feel slightly better. If this behavior repeats, observe carefully. It might not just be a new habit, but a cry for help. If your cat suddenly sleeps much less than usual, it's a worrying sign. She might be in pain and unable to relax. Without proper rest, even the most active cat soon becomes lethargic and apathetic. Conversely, if your cat starts sleeping almost all day, that can also indicate that her body is fighting illness or inflammation. Any sudden change in sleep routine is a sign that something may be wrong. When in pain, cats often seek cool, dark, and quiet spots under the bathtub, behind furniture, and so on. This instinctive behavior helps them lower body temperature and ease discomfort. Such hiding can be an important sign of declining health. If your cat used to leap onto shelves or wardrobes but now avoids high spots, she may be experiencing joint, spine, or limb pain. Jumping has become uncomfortable or painful. The cause might be arthritis, injury, or inflammation. This behavior may look odd or even amusing, but if a cat sits or lies with her head pressed against a wall, it's a serious warning. It can indicate severe headaches, neurological disorders, brain injury, poisoning, or tumors. The cat is trying to relieve the pain. If you notice this, seek veterinary help immediately. If your cat is resting quietly but breathing rapidly or shallowly, especially if it's not hot, and there was no stress or physical exertion, this can signal heart or lung problems. Take your pet to the vet as soon as possible. In addition to behavior, other warning signs include watery eyes, nasal discharge, or redness of mucous membranes may indicate viral infections, bad breath, possible dental problems. Changes in coat condition, dullness, dandruff, bald patches, excessive grooming, or refusal to groom. Dilated pupils, squinting, or a painful facial expression. Changes in mucous membrane color, pale, bluish, or yellowish tint. Rapid weight loss despite normal appetite, possible hormonal disorders, infection, or cancer. Abnormal body temperature, below 37.5 degrees Celsius or above 40.5 degrees Celsius. Panleukopenia, feline distemper, a viral disease transmitted through contact with infected animals or objects. It affects the intestines and bone marrow. Symptoms: lethargy, high fever, loss of appetite, vomiting, yellow or green foam, foul-smelling diarrhea, skin inflammation. It's a dangerous illness that requires complex treatment. Feline herpes virus infection affects the respiratory tract and eyes, spreads through secretions. Symptoms: lethargy, fever, nasal and eye discharge, conjunctivitis, corneal ulcers, and in severe cases, coughing and shortness of breath. Treatment is symptomatic. The virus remains in the body for life. Palissy virus infection, highly contagious, transmitted through saliva and mucus. Affects the respiratory system, mouth, and joints. Symptoms: sneezing, runny nose, mouth ulcers, drooling, loss of appetite, fever, limping. Treatment includes pain relief, anti-inflammatory medication, and antibiotics. All 3 diseases can be prevented with annual vaccination. The most common are conjunctivitis and blepharitis. Causes: injury, bacteria, viruses, autoimmune reactions. Symptoms: redness, swelling, tearing. Treatment: antibacterial and antiviral eye drops or ointments. Most common: tartar buildup, gingivitis, and periodontitis. Symptoms: bad breath, halitosis. Difficulty: eating or chewing on one side. Weight loss, excessive drooling. Aggression, when mouth is touched. Blood on toys, food bowls, or saliva. Diagnosis: veterinary examination. Dental x-rays, especially to detect resorptive lesions. Blood tests. Biopsy, if tumors are suspected. Prevention: annual vet checkups. Regular toothbrushing with cat-specific toothpaste. Dental diets and treats. Professional plaque and tartar removal if needed. Includes cystitis, urolithiasis, and crystalloria. Symptoms: difficulty or pain when urinating, blood in urine, refusal to use the litter box, vomiting, loss of appetite. Treatment is individualized. Make sure your cat drinks enough water, about 40-50 milliliters per kilogram of body weight per day. Cats can develop both benign and malignant tumors, often affecting the mammary glands, stomach, or intestines. Early stages may show no symptom. Regularly check your cat for any lumps or swellings. Early detection of cancer greatly improves the chances of successful treatment. Your cat's health is in your hands. Even minor changes in behavior, appetite, or appearance can be early signs of serious illness. Be attentive and never delay a vet visit if something seems wrong. Regular checkups, a balanced diet, and loving care are the keys to a long and happy life for your pet. Thank you for watching. Don't forget to subscribe, like, and share this video with other cat lovers. See you next time.